We're now going to go to a practical learning session. What I'm going to do is have you take this test, but then I will subsequently provide an explanation of what the answers are. Case 1. This slide shows an optic nerve image. The cup to disc, in my estimation, is about 0.6 or 0.65. I would not refer this patient because there's healthy rim tissue and the cup to disc ratio is less than 0.7. Case 2. The image shows striations coming away from the optic nerve head. Those striations are optic nerve fiber layer. So these are the nerve fibers that form the optic nerve. They are evidence of healthy tissue. Case 3. What is this? This is an artifact. Something is blocking the camera from seeing the retina clearly. There is no pathology in the fundus, but still this photo should be taken again to eliminate the artifact. Case 4. This image shows dramatic new blood vessels growing on the optic nerve. These new blood vessels often occur after diabetic retinopathy, and this is most likely proliferative diabetic retinopathy. Case 5. This image is gradable. It's not perfect, it's a little hazy to look at, but certainly can be graded. The fovea looks fine. The optic nerve is quite concerning for glaucoma, probably is glaucoma, and definitely should be referred. The cup to disc is large, it's probably greater than 0.8. Case 6. This image has a nice quality, and you can see the optic nerve and the macula quite clearly. The nerve has a healthy appearance with a cup to disc of about 0.6. There are drusen outside the central region. These drusen are not indicative of disease, although it would have been okay to refer this patient. We worry more about drusen around the center of vision, around the fovea. Always refer if you have any doubt, because these images will be reviewed and they can be called and told not to come if there's a problem. Case 7. This is a difficult optic nerve to assess. The cup to disc ratio is around 0.7 or 0.8, but what is noteworthy is the inferior rim tissue is missing. In fact, if you look very closely at this image, you will notice less nerve fiber layer striations in the inferior rim. This is probably glaucoma and should be referred. Case 8. This image shows a healthy optic nerve. There are several findings of abnormality in the retina. There are dot hemorrhages, some microaneurysms, and the arrows are pointing at some lipid in the retina and a microhemorrhage, a small hemorrhage. This patient should be referred because there is diabetic retinopathy present, although this diabetic retinopathy does not appear to be vision threatening. Case 9. This is a clear case of macular degeneration. There are lots of creamy yellow lesions which are drusen. These are large drusen or confluent drusen. Another finding on this photo that is concerning to me is the optic nerve appearance. There does seem to be some paleness to the optic nerve. Case 10. This is a poor quality image. I cannot see the center of vision, the macula, or the fovea very well. I can see the optic nerve. What is being pointed at by the arrows are artifacts. These are light hitting the retina in a funny way because of the lens. These are not drusen or lipid. This image is of good quality and is gradable. The optic nerve appears healthy. There are some very minor abnormalities that one might see in the center of vision. I see one yellow hard exudate, but otherwise nothing else of concern, and I would not refer this patient. Case 12. These optic nerves are striking for how pale they are. They should never look this white. This could be from many causes. It could be from compressive lesions, from previous blood vessels breaking in both eyes. But in any case, this condition needs to be referred. Case 13. This image is of poor quality. The center of vision cannot be viewed clearly. This is an ungradable image, and therefore the patient must be referred. This image is of excellent quality, and there are probably 2 reasons to refer the patient. First, there is macular degeneration. The center of the fovea has an obvious abnormality, and it is considered geographic atrophy with pigmentary changes. I'm also concerned about the optic nerve. The optic nerve should lead to a referral even without the retina because the cup to disc is about 0.8. And it's hard to tell for sure because it's slightly tilted, but this may be glaucoma as well. Case 15. This is a myopic fundus. You can clearly see the choroidal vessels, and the optic nerve looks healthy. While this image may be concerning on initial look, it is a healthy eye and should not be referred.